of the class. Yes.
All right, thank you very much. Thank you very much for again joining this lecture. Today we are going to talk about two things. One is about health promotion, oral health promotion for that matter. We are also going to talk about infection control in dentistry. Am I audible enough? And for those who are watching video, can you see me?
Yes, doctor.
Yes, doctor.
Okay.
And we can see you.
All right. So today we are going to have two short lectures. And as we said, we talked with Paddy. Next week, my other colleague will take over and will be conducting some other lectures, which we feel relevant to you. And you'll just be whoever you'll go to do your internship from, you'll just be stars because you'll be comprehensive doctors. You'll not be just referring without proper information. You'll be referring dental patients with knowledge of what someone is supposed to be doing. First, you'll be referring to dental surgeons. And when you are also maybe in the health center force, you'll be referring to public health dental officers who are the other cadre in oral health service. But you definitely find that you'll be very unique because you'll be knowing at least something about dentistry. So today I think I should share my slides. The first one is about I'm going to share. The first one is, can you see it now? Paddy, can you see it?
Yes, doctor, I can see the slide. Maybe put it in presentation mode.
So I put it in presentation mode. So is that okay? Is that fine?
Hasn't it changed on my screen?
It hasn't changed.
Slideshow.
Slideshow. Has it come now?
Yes, doctor.
So we can now go on. All right, so today we are going to look at, first of all, dental health promotion. Sometimes the word dental is used interchangeably with oral health. So dental health or oral health promotion. Of course, oral health involves so many aspects of the mouth and the environment. And when we talk about dental diseases, we usually zero onto periodontal diseases and dental caries. But when we say oral diseases or oral conditions, it involves so many things, including cancers. It involves so many things about maybe herpes simplex. It involves so many things. It involves oral gum mutilation. It involves so many things. But today, in this lecture, we are going to talk about now like the preventive aspect of it, the general preventive aspect of all the dental diseases. Not all the oral health or oral diseases, but dental health diseases, which includes, of course, dental caries and the periodontal diseases. Remember, periodontal diseases are several. There are many, and we only looked at gingivitis, which progresses to periodontitis. But there are some other gingival or gum diseases like acute necrotic ulcerative gingivitis. It is some form of very uh, bad gingivitis that involves the ulceration of the oral mucosa. And it is caused by some other funny diseases. You find the mouth is foul smelling, but it is in a special way. I didn't want to include it, but it is also some kind of gum disease, which is very, very rapidly progressing. And you also find among the children, you find these other viral diseases, the, uh, uh, the gingival which is viral in nature, whereby maybe children will present with fever and the oral sores and maybe yes, difficulty in eating, like she loses appetite. Those are some of the characteristics of such diseases. We didn't want to go into the details of those because we fear it's for now beyond the scope of this course unit. So we want also you people to be oral health promoters wherever you'll be. We can't know where you'll be. So you have to promote oral health through effective oral hygiene. We also would like you um, to try and facilitate the early access to preventive dental services, because wherever you will be a doctor. Now, when you are a doctor, you will not, someone will come to you with toothache, someone will come to you with oral diseases, dental diseases. You will not tell them, you know me, I'm a doctor, but I can't help you. That would be shaming us. So that's why I brought in this course unit, so that you have a glimpse of what takes place in the oral cavity. So you will be able to detect those diseases, those simple diseases which are common out there in the countryside and also in towns, wherever you will be, and refer them to the um, appropriate specialists, of course, after making a diagnosis, which is very good. So, but the most important thing is for you to help us with the oral health workers to promote the use of topical fluorides. Topical fluorides may include toothpastes, may include fluoride vanishes, it might include the fluoridated mouth rinses. So all those you promote them because research has found out that fluorides promote good oral health. And where fluorides have been used, there is a reduced dental caries. So, you have to help us do that. So, but before that, we of course look at diet and its connection with the dental caries and other especially dental caries. The first thing is we always look at what we call keriogenic foods and then non-keriogenic foods. Now with keriogenic foods, those are the foods which promote dental caries. Those are the food which promote the presence of biofilm, which biofilm, of course, you know, it's a colonization of bacteria, of keriogenic bacteria, and which can progress also to being caliculus. From caliculus, you know how it interferes, I mean, to promote the Can we go ahead?
Yes, doctor.
Right, so I'll go ahead and share again because we lost the timing. The sort of we lost our I think the internet timed out, but now I think we are on. So we are looking at ketogenic foods. But I think you leave your mic. And
Yes, I hope.
so let's continue like that now. And then I'll go ahead and share the screen again.
Yes, doctor.
Hope it doesn't time out again.
Mm.
All right, guys, that's what technology is doing to us. I think we have to get used. So we're looking at non-ketogenic foods, and then we say bread, sandwiches, toasts, as long as it doesn't contain sugar. You know there is some sugar in this bread. Then as long as, so when you look at the list of ketogenic and non-ketogenic foods, you can see that on the non-ketogenic side, there is unsweetening, or there is natural sweeteners added. You know there are some natural sweeteners. There are sugar-free confectionaries. There is fresh juice as long as you don't add in sugar. As long as you don't add in artificial sugar, then this becomes a non-ketogenic food. But the moment you add in artificial sugar, then it becomes ketogenic. So ketogenic foods and then non-ketogenic foods, you can check the table and compare and see. You'll find that in non-ketogenic foods, these are ordinary foods, but there is no sugar added or factory made sugar added, or there is some natural occurring or sugar-free stuff added. So we are looking at the ketogenic foods. You can see them. Can you still see me, Pade? Hello, can you see the ketogenic foods?
Yes, you can see the ketogenic sweets.
So
Food.
those are the kind of foods you people like, and those are
Chips, fries. Oh God, no, not again.
seen this one, and we are looking at some other ways of preventing these dental diseases, and we looked at the foods, and now we are looking at a toothbrush, which is the principal instrument for bacterial plaque removal. Of course, toothbrushes appear in so many forms and in varieties of shapes and sizes and texture. And there are so many toothbrushes which have been promoted and sold out in the market. But there are characteristics, definitely, of toothbrushes. And depending on which part of the tooth you are, I mean, which area of the jaw or the arch you are brushing, you might need a different specialized toothbrush. For example, when you're brushing the eights, those are the wisdom teeth which erupt later in life. Using ordinary toothbrushes may not effectively clean those areas around them. So there is always the use of wisdom kind of toothbrushes. And also, but the rest of the brushes can brush anywhere in the oral cavity, save those other posterior areas. So we have always to be careful with the kind of brush we use. And also the length of the brushes we use, like not the length, but the time we use our brushes. Once you discover that the bristles of the brush are bending, then they are no longer effective. And basically, we are supposed to change our toothbrushes after like 3 months. If it can go up to 3 months, you just discard and use a different one. And this time of COVID, just a reminder, in case one has got COVID, please and you recover, just throw away your toothbrush. And if you are in a community where you put your toothbrushes in one store area, one cup or one place, make sure that you don't put it there. You get a way of storing your toothbrush separate from the others, because this can promote COVID-19. So they are in different sizes, different types of brushes. There are those ones which are manual, which these are the ones we use normally. And then there are, of course, electric toothbrushes. These manual toothbrushes, of course, are affordable, and they are the ones we know definitely. But I have to tell you that there are those ones which are also electrical. And yesterday I was looking at literature, some published literature, whereby a randomized controlled trial was used to see the efficacy of these two types of brushes, both the manual and the electrical, and it was discovered, or it was found out, that the electrical ones actually do it better. So, and so they were recommending electrical. Those who can afford electrical toothbrushes, they are available, and they do it better. But all these, whether electrical or manual, their efficacy depends on the user. So you might go in and buy a good electric toothbrush, but if you don't know how to use it, it still will not be effective in promoting oral health. So what you are seeing are the characteristics of an effective toothbrush anyway, whichever we have. It depends on the size, the shape, and the texture. I talked about the shape, like the head of the toothpaste. It should be small so as to clean the wisdom teeth effectively. And it should be easily be manipulated. It should always be readily cleaned and aerated, and should be, to some extent, durable and inexpensive. They are inexpensive toothbrushes. You have seen those ones which come in our toothpaste, like ABC Dent and some other toothpastes. Then there are those ones which, I don't know whether those are durable, but there are those ones which are expensive and they are durable. Yeah. And so we prefer using end-rounded filaments or bristles. Those other bristles are the head, which are attached to the head of the toothbrush. The more rounded, the better, because when they are rounded, then it means they don't injure the gum. Even when they enter into the interdental, interdental area, they don't puncture the interdental papillae. Still on the manual toothbrushes, well, this is not a big deal. Manual toothbrushes, the parts, but we all know that it has got to have a handle where you grasp, and then it has got the head, which has got the bristles or the filaments, and then the shank, which connects the head and the handle of the toothbrush. This is just for you to know so that when you are promoting oral health, you know what you're talking about. And these are some of the techniques of brushing. In our assignments, you'll find the more details and some pictures that will draw your attention, which will draw attention to. But in summary, just grasp. There is what we call the hand grasp or grasp of the brush, just whereby you just you grasp the toothbrush handle in the palm of the hand with your thumb against the shank. We have just talked about the parts. So grasp the handle in your palm with your thumb against the shank. There, you just maintain the fulcrum, you maintain the stability of the toothbrush, and you apply minimum power. So you make some kind of sequence. You make some sequence like as if you are making a circle, some circular movements, such a way that you brush on each and every tooth. Remember, we are brushing the clinical crown of the tooth. If you can go back to anatomy, you are brushing the clinical, not the anatomic part of the crown. And so you can count about 6 strokes in each area. And then, of course, the frequency of brushing matters. So all this, the most important thing is grasp. In summary, grasp your toothbrush. You make rounds or you make circular movements in a sequential way, so that you brush in every area. For example, the lingo, the barco, the distal, and then also depending on the frequency of brushing, then you may realize the efficiency by not having lots of the biofilm or dental plaque. So we also look at, there is brushing using the toothbrush to clean the biofilm or the dental plaque, but remember there is also the flossing. You can see the length of the floss in the assignment. In the textbook, you'll just look at the size of the dental floss that you need to have so that you brush. These are some of other adjuncts. For example, these are interdental brushes. All these are interdental brushes. This is the dental floss. You always see them. These are some other forms of dental floss for brushing the interdental areas, because we spend so much on the surfaces, on the accessible surfaces like the barco or the lingo or the palatal aspects or surfaces of teeth. And then we forget the interdental spaces. So in the interdental spaces, if you don't floss, if you don't use dental floss in the interdental spaces, you end up by having class 2 cavities, because remember, class 2 cavities is interproximal or interdental caries. So those interdental caries will come because there is no effective brushing taking place between adjacent teeth. So of course there is flossing, there is brushing, but there is also dental screening. Like when you have time, once after 6 months, you should always go for dental screening, just dental checkup, yeah. And then the dentist will be able to see whether you are brushing all right or whether you have some dental caries which can be removed. And also for children, even adults, by the way, you can once in a while have your fluoride vanish applied, especially if your molars have got lots of pits and fissures. And then by getting the information like what I'm giving you now, you become aware of how you can promote your individual health, oral health, and also promote the community oral health. So that's the end of this short lecture. Let me also share a new slide, which is about infection control in dentistry, and then the questions will come later. I hope the network doesn't go. My network won't go. So we are looking now at infection control. Pade, can you hear me now? Are we together? Hello?
Yes, doctor, I can hear you.
We are very together.
Yeah, okay, that's good. So that was the first short lecture. I'm now going to conclude with infection control in dental settings. Because remember, ladies and gentlemen, colleagues, remember you are going to be district health officers, you're going to be researchers, you're going to be medical superintendents, you are going to be hospital directors. You need to know this information such that when the dental team comes to you, you advise them. So that's why we bring in this infection control in dental setting. It's very important these days. It's very important these days, of course, in this COVID era. This is just a reminding. I'm just reminding you about dental hygiene, but we are just in a dental field. Hand hygiene is very important. It is more important actually than never because of COVID-19. But in dentistry, we have always tried to do that. And we are looking at when we should be washing our hands. Here, of course, we say when hands are visibly soiled. But these days, because of COVID-19, we say every time because you cannot see these other microorganisms. So even without seeing anything, we wash our hands. It is now our routine. And we do it before seeing a patient and even after, and even in between there, because you might have touched yourself. There are some people who make mistakes of touching their instruments with bare hands. So those ones are usually contaminated, and so they should be sterilized. This is some of the information that you always be on the lookout when you are going to dental settings, or when you are supervising the dental units. Always look at this stuff. So hand hygiene is very important. Of course, the use of soap and water is very important. This use of visibly soiled shouldn't be used now because we have to do it whether you see anything on your hands or not. It's a routine, it should be a routine. So hand hygiene, then we also from hand hygiene, we are looking at the personal protective equipment these days is very important. As a, in dentistry, we use so many gloves, even for examination and treatment, we use lots of gloves. Now, this period, of course, in the COVID era, we have even some of the appropriate PPEs include gloves and glasses and masks and many others. So you as an officer, a director, or we should always ensure that there is a provision of sufficient PPEs, and then, of course, educating the dental health care providers on proper selection and use of PPEs, because remember, some dental health care providers might not be knowing these things, or they might be knowing, but they ignore them. So it is up to you, the medical officer in charge, to remind them, because it will be their bosses at some time. Remind them about wearing gloves always. I have seen in our setting where someone comes and examines, gets a dental mirror or something and examines a patient bare-handed. And some people don't even wash their hands. And some people even go to the extent of washing gloves and then they reuse them. Someone wearing the same gloves from one patient to the other. So this is wrong. They should always be reminded. And they shouldn't be reminded only to wear a different glove after seeing a patient, after a new patient, but they should also be reminded to perform hand hygiene. There are some protective clothes. I've seen that these clothes are not being given to the dentists, but these ones should also be given to the dentists because they are equally at risk. So you people, whenever you are planning, don't plan for only MOs and nurses and laboratory staff. Please always remember to plan for dental personnel as well. Yeah, so protection is very important. And the most important thing is removing PPEs before leaving the work area for dentists. I've seen and I was always been frustrated where there are kiosks and restaurants and canteens. You see medical students or dental students or dental staff proudly moving with their clinical coats to the canteen. They sit and start eating with their gowns. Gowns are not uniform, but they are personal protective equipment, which should always be left at your place of work. Others these days, because they want to be identified as essential doctors, they always put their gowns, their clinical coats at the back of their driving seats or the other side, so that when the police see the gowns, the white coats, they know that, okay, this is a very important person, but that's wrong. We should always leave them at the place of work. Of course, this is some cough etiquette. That is what you call respiratory hygiene or cough etiquette. We should always instruct. These are some of the instructions to patients with symptoms of respiratory infection. Remember, you people, you are working with TB patients, we are working with people with halitosis, we are working with COVID patients. So these are some of the reminder. Of course, this presentation was prepared before the COVID era, but we always have had respiratory infections. Someone comes in coughing, so remind him to cover their mouth or noses when coughing or sneezing. These days it is easier because every other patient is having masks. But you know, like in the dentist, for the dentist and ENT personnel, you can't examine someone when he's putting on a mask. Also, remember the medical officers, there are some instances whereby you ask a patient to open the mouth during examination, and then you go ahead to ask them, you say or say nyama nyama, such things. So we are all in danger. So we always recommend the use and disposal of tissues. Some people use tissues and then they put them in their pockets, or they just dispose them anywhere. This is quite wrong. And of course, after doing that, after coughing or sneezing, remember to perform hand hygiene. In developing countries, you notice that they use many no touch when you go to the laboratories, no touch. But maybe even here there are those other no touch stuff. You clean yourselves remotely. So if we can have them in every dental setting, that would be fine. Also, in the waiting area, probably before they come in, before they enter into the dental clinic, providing a place where they can wash their hands is also fine. And if it's okay, someone comes in with a poor mask or an old mask, if you can provide masks for every patient you see in settings where you can handle, that's better for you, because it provides you, it protects you and also protects the other clients. And there should be a provision of enough space, so that when someone is proved to have respiratory infections or is coughing, is put in a separate area from those others who are not coughing. That is, I'm talking about dental settings, and I'm telling it to you so that at least when you become in charges and you're involved in the planning in the Ministry of Health or in the big hospitals, remember these ones are really necessary for dental settings. And as I said before, you always have to educate these dental health care providers, because at many times they forget. And so a constant reminder will help prevent cross-infection in dental settings. And also remind them about the sharps safety. I know you have studied this, but this is just a reminder. And I'm just re-emphasizing because I know you'll be big people who will be involved in planning for dental clinics in your hospitals and in your areas of jurisdiction. So always provide sharps containers, because that's where we have special sharp instruments, including needles, scalers. Those are the ones for removing cariculus. And then the bars, those are the ones which are used to remove caries. And then the rub knives, those are used in dental labs. And then the wires, you have seen people who undergo wiring after road traffic accidents. And so when they are removed, they have to properly dispose of them. Some people have a habit of recapping used needles by using both hands. This is dangerous because you can easily prick yourself. This one-handed scoop means we normally use it when, for example, scooping dental powder from somewhere. So using what we call a one-handed scoop technique, this is for device. It is a device used for holding the needle cap when recapping needles. They are used between multiple injections and before removing from a non-disposable aspirating syringe. You know our dental needles. We have dental syringes and dental needles for those who have gone to dental clinics. So when we are using, it is that device that we can use to recap and recap these dental syringes. And we used, sometimes, of course, we don't have permanent dental syringes. We use disposable syringes in our setting, for example, in our hospitals here, because we don't have metallic syringes. Those are permanent syringes. So all these needles and scalpel braids and other sharp items should be placed in puncture-resistant containers. So these are some of the reminders, the sharps in the sharps side. There are also some safe injection practices. These ones I think you already know because you have started injecting them. This is the nursing aspect of it. All those, yeah? Not to use needles or syringes for more than one patient. Yeah, you use once and throw. Unlike those days, we would use one needle. Those days when I was a child, maybe I was younger. I used to see people using needles and then sterilize them, or they boil them. Their kind of sterilization was just boiling, which is not a form of sterilization, but it was a form of disinfection. But they used to boil them. That was before the coming of HIV and those other diseases which have come in these days. So they would just use one needle, and then they used to be metallic. And then after they reboil and then reuse them, which is no longer applicable these days. So those are some of the safe injection practices in dentistry. Those are some of the, from 1 up to 8. You read and understand them. So also, of course, you cannot control infection in dentistry, in dental settings without doing sterilization and disinfection. So we always clean them, of course, remove the clean and the process for those reusable dental equipment. And we sterilize before use or before use on another patient. Yeah, so we always follow the manufacturer's instructions, and in bigger dental clinics, we always assign dental assistants to process, they do the sterilization, the cleaning, then disinfection, and then sterilization. And we always encourage them during sterilization to wear appropriate PPE while handling those soiled equipment. Of course, there are some other forms of sterilization. They are mechanical, chemical, and biological. And we always put monitors, like in advanced countries or advanced clinics here in Uganda. When you go there, you find there are monitors which are attached to sterilizers, and also some color coding on sterilization packs. And these packs will change color just when they are ready, they change color, like from red to green or green to red, or whichever color you choose to put on the code of the sterilization packs. Yeah, but otherwise, some sterilizers are equipped with monitors. That is that before the required sterilization level has been reached, you can't open the sterilizer. Some of the environment, of course, control. Because you'll be the managers, you'll be the directors, you have to establish policies and procedures for routine cleaning in your environment. Mhm. And also, like your working area, the dental working areas where they put their pens, where they put their records, should also be clean and disinfected. And then also, while cleaning those areas, you should select areas which will not interfere with the surface, like will not destroy or spoil your working area, your surface. There are some disinfectants which react with the surface covers. So one needs to be careful and follow the instructions from the manufacturers. Um, so those are some of the lectures I wanted to deliver to you today. If you can hear me, this is now the time for questions, concerns, comments, and stuff like that. Back to you, Paddy and group. Hello?
Doctor, thank you so much. I want to say that,
Yes.
and I'll check in the group. For those who have concerns, please raise up your hands. And Doctor, I want to first thank you on behalf of the class for taking us through this time. It has been a good month with you, and we really appreciate everything that you've done for us. We have studied today on the cryogenic foods and the non-cryogenic.
Yes.
I've been wondering, see, what is the let me say characteristic of this artificial sugars that makes or makes it like highly susceptible to produce to dental caries.
Okay, you might have to ask your question again because you kept cutting. I didn't follow you up very well.
Okay, doctor. My question
Yes.
is, what is the characteristic of these artificial sugars in
What
cryogenic
is the
foods?
characteristics?
Yes.
What are the characteristics of cryogenic foods? Oh, I can't
These
hear.
okay,
There is
doctor, I will repeat.
some interference there in your area.
Okay, I'll type it, doctor. In meanwhile, if there are people have raised hands, they can ask. Doctor, I'm going to put the question in the chat.
Okay. All right. Okay, someone wanted to know whether we need to know all these prevention things. You know, information is not poisonous. You can have it because, as I said before, you'll be doctors and you'll not tell people that, you know, I don't know this, because they always come to you and you are the only doctor in a setting and you have to give them advice. That's why we brought in all this. So Pade is asking what is so special with artificial sugars that predisposes to dendrocaries not in natural food like rice. So what is special, Pade, is that these sugars are refined. If you can go back, I think, to your chemistry, there is these sugars which are they refined the final molecule of sugars which are easily acted on or which act as a substrate for bacteria. They are those refined sugars. I think the last molecules of sugars, very refined and very easy to be utilized by the karyogenic bacteria to produce the lactic acid and other metabolic substances. This is different from the natural occurring, I think the natural occurring sugars are polysaccharides, whereas these sugars, which are easily utilized by the bacteria, are monosaccharides. So the bacteria find it very easy to break or to utilize the monosaccharides, which are found in our artificial sugar. So they find it difficult to utilize the polysaccharides, which are found in our natural occurring foods. And someone is asking whether these things we are talking about today are examinable, maybe. Is it what Tumwesi Jamugisa is saying? So, Pade, have I answered you well?
Yes, it was just straight on point.
Yes, so
Easily utilized.
monosaccharides and polysaccharides, yes. So that's why we should always avoid, remember, Patti, it is not good always to, wherever you get female friends, to give them a supply of sweets. It's not good.
But doctor, my girlfriend,
Pardon?
my girlfriend loves chocolate.
Now, okay, we shall talk to that, to talk about that later. I wanted to give you some advice. Okay, so any other question? Next time you buy her an apple.
Okay, doctor.
All right. Okay, are we done? Should we go? Now
I
I'll
think so.
send.
Thank you so much.
Can I
The
send
assignment.
the assignment later, or can I read it for those who are able?
I think you can read it, then
So now we are going to, now this is going to be assignment 4. And ladies and gentlemen, I know all of you have where to write, but maybe you'll have to mute your microphone because it is interfering. Okay, thank you. So our reference textbook again is going to be the one I gave you last time, basic guide and basic guide to oral health education and promotion. And that's the book I've written because it is simplified. Please don't go to Google. I just got this textbook because it really fits for you for the lectures I've been giving. It is very simplified. That's why there were so many others as you see in the system, but I basically chose this because you don't have the time. I don't want you to go to Mr. Google. That's why, and I always want specific things when it comes to the exams. And when it comes to examining, remember, I only go into this textbook and also the slides. So please don't go and ask Mr. Gogo when I'm available. So that's why I bring it again today. So chapter 14 of this book and chapter 19 of this book. Now, in chapter 14, we are going to look at the anti-plaque agents or antibacterial plaque agents. And here I'll be interested, number one, toothpaste or toothpastes. You'll basically find it here, toothpaste in chapter 14. You'll find toothpastes. And what I'm interested again about these toothpastes, because there was a question which I intentionally dodged last time. It was asked by someone, so I was keeping it for today. So toothpaste, I'll be interested in A, the concentration of the fluoride or fluoride concentration in these toothpastes for both children and adults. Fluoride concentration for children and adults, that's A on toothpaste. B, I'll be looking at the constituents of toothpaste. What are toothpaste? What comprises toothpastes? The various constituents. Then C, I'm interested in the functions of this toothpaste. Some people use them, because they find them at home. But what is the use? What are the functions? What are they meant to do? Then D, I'm interested in you knowing what you can advise to patients about or clients or your colleagues from the social sciences or the engineers, your friends, your boyfriends and girlfriends, your spouses, what advice, your children, what advice do you give them about toothpaste? All this information is in chapter 4 of our textbook. Then that was about toothpastes. Number 2, we went on chapter 19. In chapter 19, so in number 2 in chapter 19, we want to look at A, toothbrushes. I've given you a glimpse of toothbrushes in the oral health promotion, and also, of course, I gave you about toothpaste briefly. I want us to go in a little bit more detail and read and understand. These are very well written notes, which you'll also read and understand and make your own notes. So, in chapter 19, I'm interested in A, toothbrushes. B, brushing techniques. C, interdental cleaning methods. Remember, in the interdental cleaning methods, I mentioned about, and you also saw pictures about the floss, and then also the interdental brushes. You'll also find there rubber toothpicks. Now, we usually use toothpicks just in parties. Our usual tree or wooden toothpicks. But here you'll find some rubber toothpicks, which are also very, very essential. So that's the assignments about toothpaste. And in the toothpaste, I'm interested in the fluoride concentration for children and adults. I'm interested in the constituents. I'm interested in the functions. I'm interested in the advice you give to patients about toothpastes. I'm also interested in chapter 19 of the same book. I'm interested in toothbrushes. I'm interested in brushing techniques. I'm interested in the interdental cleaning methods or interdental cleaning armamentaria, comprising of floss, brushes, and rubber toothpicks. Remember, you might do everything, like you might brush, I don't know, Sijui how many times. But if you are not doing it right and using a good technique, you'll still get dental caries or gingivitis. If you do brushing, I don't know for how many minutes and how many times, but without flossing, you still have dental caries, you still have gingivitis or even periodontitis. So that's why you have to combine brushing and flossing. You might find that you also need to use some mouth rinses. I didn't want you to go in the details of mouth rinses. You might, however, find them in the anti-plaque agents in chapter 14, but that's not my interest. You can just read it for your own good, for your own information, to advise Ugandans or other nationalities. Back to you, Pade, and the other colleagues.
Thank you so much, Dr. It has been great for you to lecture up. Are there any more
Yes.
questions?
If there are other questions, we can go for them before we go.
There are no questions, Doctor.
There are no questions, and people are tired even. They are just, But we once again apologize for wasting your time. But Pade, kindly get in touch with Dr. Rubaku so that you advise your class appropriately. But you also keep in touch with me just in case of anything. And remember to
Doctor, I already got it.
Yes. Remember to be to check in the LMS and download any book you want. If you don't get access, I always get I always get notifications, and then I share with you. Okay. Thank you very much, ladies and gentlemen. God bless you, and we meet sometime again, maybe when you are doing exams.